young patient. Generally, we put it in a little elderly patient. So when a surgery goes with a prosthetic valve, like 15, 17, 20 years after that, the valve automatically degenerates. So we can't say that it's a failure of the surgery or what, because surgery is done in a proper way, but the valve, natural process is like that, like 17, 18 years later it degenerates. So in this case, where it was a tough decision, because first of all, the patient was being planned for a TAVI. TAVI, as of now, all of you know what is the TAVI, and Dr. Guru has explained everything in detail. So I will not go into detail. Now the thing is, there is a technical glitch there, that the size of the stents, whatever we put for a TAVI. Now we have two different types of TAVI in India. One is my valve and one is Hydra valve. So these two TAVIs are functioning properly, but having said that, the cost is going to be exorbitant, and for a normal patient it is going to be little high, because the stent cost comes around to 13-14 lakhs rupees, only the stent cost. So the procedure cost and all those things are different. Now cost was not an issue for this patient because we had already planned for a TAVI. But having said that, the technical glitch was the anatomical glitch, because the correct size of the stent was not available, and it was not able to, we could not fix it actually. So then there was a collective decision, and then how to go about it. See, we can't do a re-surgery, taking out the valve, and then the complications are more. Secondly, we can't do a TAVI also because of the anatomical problem. So this was a very wise and intelligent decision to place a stent or place a valve inside the valve. Already the valve was there, and so a valve in valve kind of situation. For a cardiologist, it is like a valve in valve, because one valve is there and another valve we are using it. But surgically, they have placed it in a very correct way. And the word sutureless means, generally when we replace a valve, we take out the whole thing and again we put the new valve, and then we do sutures. We have to put sutures to keep the valve in place. But here it was like sutureless, because already the calcium also would have been there, and it will keep the valve so tight that the valve, the misplaced, somebody can ask whether the valve will move up and down. It will not, because already there is a ring inside, and already the valve is there, so it will grip the other valve inside, and then the patient can go back to its own ways, and then after 2-3 days, generally these patients can be discharged. So first of all, the cost is extremely low as compared to a TAVI, and of course the risk is a minimal risk as compared to a TAVI. But having said that, when it is being done by experts like Dr. Govini and team, I think it makes a lot of difference to the outcome of the patient. So I should congratulate Dr. Govini and team, and me being a part of it, Dr. Guru being a part of it, that we have, combinedly we have tried to do whatever is best technically as well as scientifically. Thank you all.